started the timer and here is your system. Right, so if you have read and understood, considering its communication skill station, can we begin?
Hello, good morning. I'm Dr. Kuldeep, one of the surgical candidates. Can I know your name, please? Name and date of birth, please.
Name in relation to the child.
Name and how you connect related to the patient, please.
Yes, doctor. I'm Alice. I'm the mother of the child.
How you, ma'am, Alice? Can you tell me you want to discuss regarding your kid with the Dr. Mann? How can I help you?
Yes, doctor. I don't know. Like I got a call that my child is not in good condition and he has been brought to the hospital. I'm so worried, doctor. What has happened to him?
I'm very sorry, doctor. I'm very sorry, Alice. Can you tell me what you know about so far about the child?
I'm not very sure, doctor, but I was told he's not in good condition, and he's taken for operation or something. Can you tell me? Is my child fine? Like, what has happened to him, doctor?
Ma'am, can you take a seat? I will let you explain. Mr. Ellis, your kid is apparently, as per the history, your kid apparently fell off from a climbing frame and probably hit seriously herself. And I apologize that we couldn't see you before the surgery, before taking the kid to the theater. But as it is an emergency condition and patient is unconscious, so we have to take him to the take the kid to the surgery, ma'am.
Okay, so how did he sustain this injury, doctor?
As per the history, your kid is fell off from a climbing frame, and the kid has a bruising and abrasion over the tummy, which is probably we are suspecting over the investigation. It is a rupture of the spleen. It is an organ present in the tummy which helps to fight against the bacteria. It helps in immunity mainly, and it is a very serious condition. It lead to significant blood loss in the tummy, and if we don't operate, the kid may lost to life also. So sorry to say that.
Oh, doctor, like what do you mean? Like he is going to die? Like what do you exactly mean, doctor? I don't understand.
I know, ma'am. You are going through the difficult phase, ma'am. The spleen is an organ present in everybody's tummy, ma'am, towards the left side, which helps in fighting against the bacteria, and it helps in immunity, ma'am. Whenever there is an injury to the spleen, it leads to significant blood loss in the tummy area, ma'am. So if we will not manage that bleeding, ma'am, it leads to significant blood loss, and patient might lose life to that, ma'am. It's a serious condition, ma'am.
Doctor. Okay. How can you say? Confirm. How can you confirm that he has this injury to his spleen or something?
Ma'am,
how did you confirm?
Ma'am, the kid underwent a ma'am scan, ma'am ultrasound scan, which locate the location of the bleeding from the spleen, ma'am. Ma'am, we for confirmation, it is not a confirmatory test, ma'am. It is just a diagnostic test. But for confirmation, we need to see intraoperatively, ma'am.
So you are not sure that it's a spleen injury, and still you want to operate on him?
Ma'am, because your kid is unconscious, ma'am, we can't take the risk of the kid's life, ma'am. It's an emergency surgery, ma'am. We need to
Okay,
take the
doctor.
kid to the.
Okay, doctor, tell me, since he was brought by his father, like, what did the father tell you? Like, what exactly happened? What exactly did he tell you?
Ma'am, the father told us the same condition, ma'am. The kid is playing in the backyard and the kid he fall off from the climbing frame, and he took the patient to the casualty with the in an unconscious state, ma'am.
But doctor, his father is a drunk, and I really want to protect my son. Like, can you help me, doctor?
Yeah, ma'am. We will surely help you in this regard, ma'am. We have a child protection services, ma'am. We will include the child protection services personnel in this, ma'am, and we will provide extra precaution to ensure the child is going to be in the safer hand, ma'am. And I will inform Dr. Mann also regarding the child protection consultation regarding the same, ma'am.
Okay, so you mean now they are going to operate on him, right, doctor?
Ma'am, the kid is already in the theater, ma'am. The surgery is going on, ma'am. Dr. Mann is doing the surgery, ma'am.
Oh my God. Doctor, so how long is the operation going to last, doctor? Can I have a look? Can you tell me?
Ma'am, as of now, ma'am, surgery is going fine, ma'am. But you can't go inside the theater, ma'am, as per the hospital protocols. But Dr. Mann will meet you after the surgery, ma'am. Hopefully, surgery will go. As of now, surgery is going fine, ma'am.
Okay, so when can I see him, doctor? When can I see him?
Ma'am, as soon as the surgery will end, ma'am, Dr. Mann will update you regarding the surgical procedure and all what had been done to the patient, and you will meet the patient soon. Patient come to the recovery, ma'am.
So do you think he'll be all right after the surgery, after this operation, doctor? Will he be safe? Will he be okay?
Yes, ma'am. He will be, ma'am, safe.
I'm really worried, doctor.
Yeah, ma'am, I can totally understand, ma'am. It's a tough time to you, ma'am, but we will help you in every regard, ma'am. Dr. Mann is an experienced surgeon, gastrosurgeon, ma'am. He is doing the surgery, and your kid is in the safer hand, ma'am.
Explain the complications and vaccination.
Okay,
ma'am.
What are the medicines? Will he need any medications after the operation?
Yes, ma'am. The spleen has some functions, ma'am. It helps it is the largest organ involved in our immune system, ma'am. We need to protect the kid against some infection, some serious infection which can cause pneumonia, which can involve the brain also. We need to vaccinate the kid against some vaccination. We need to investigate the kid, ma'am, against some infections, ma'am, like hemophilus, ma'am, like streptococcus, ma'am. We will update you regarding all the things, ma'am.
Okay, doctor. Like, but you are saying me that you're not sure with the ultrasound scan, and you have some confirmatory test. Like, still, like, you are taking him inside. So how sure are you, and how safe is it?
Ma'am, because ma'am, it is an emergency surgery. We can't wait for CT scan and all investigation. We mainly perform ultrasound test to locate for if is there any if is there any bleeding in the tummy. And on scan, we see there is a bleeding inside the tummy. We took the patient inside the OT. We will open the kid's tummy, and we try to stop the bleeding, ma'am.
Okay, so when can I take him home, doctor?
Ma'am, it will Ma'am, our first priority is patient's medical care, ma'am. It's patient medical care. If we will ensure that he will have a good recovery, we will not discharge him until we will have undertake a full clinical examination and make sure that your all concern are settled down, ma'am.
Okay, doctor. I'm really worried, doctor.
Ma'am, if you have any concerns, please let me know, and I will keep my number with the nurse here. If you want to ask any question, if you want to connect me later, you can connect me, ma'am.
Okay,
Is
doctor.
anything else? Is anything else you want to ask me, ma'am?
I just want my child to be safe, doctor, to be back again healthy.
Yeah, ma'am. We will help you, ma'am. I will make sure he is in a safer hand. Dr. Man is a very competent surgeon, ma'am. Shall I offer you a glass of water, ma'am?
Thank you.
Should have given in the beginning when you asked him to sit down.
Actually, I thought of, I forgot actually.
Two of your fellows have raised hand. Yes, please. There was a loose game, it should have said it very confidently that we have done scan and it has shown that there is a rupture of spleen. That's why we have taken the patient to the theater. So that was the loose ball. That's why, the patient's mother was very stubborn, brought you again and again in the court to answer this question. Yes, Dr. Shahid and Dr. Abdul, please, you raised hand.
First of all, it was a very nice presentation.
Yes.
Ma'am, do we require to summarize what we have asked the patient's mother at the end of this session? End of the station?
No, not that I think so. But then how he concluded that he'll be leaving the number with the nurse, and if there's any more questions, she can call and contact. Because here he is talking on behalf of Dr. or Professor Man.
Man, okay.
Yeah. So here he does not have to
summarize anything. Okay,
no,
sure.
No, here he doesn't have to.
Okay, thank you.
Ma'am, one thing more.
Yes.